The Massad Edentulous LT low-temperature impression tray. The purpose of the Massad Edentulous LT low-temperature impression tray is to improve impression accuracy for edentulous arches, as well as edentulous arches with low-profile implant impression copings. This is accomplished by heat molding and customizing the tray directly in the mouth or on a cast if desired. The trays are disposable, intended for single use only. The trays should not be autoclaved due to their thermoplastic composition. If necessary, the trays can be disinfected with an approved dental immersion cold sterilization liquid. The trays are non-sterile as supplied in the delivery container. The Massad Edentulous LT tray is supplied in 5 upper and lower sizes, numbered from 1 to 5 to accommodate any size dental arch. The Massad Edentulous LT trays are designed with openings for improved impression material retention. However, a suitable adhesive should be used for optimal results. For optimal results, it is recommended that the edentulous trays be used in conjunction with the Massad layering impression technique. However, they are suitable for use with any viscoelastic or alginate impression materials. Clinical instructions for usage of the Massad Edentulous LT tray. Choose the tray closest to the patient's ridge size. Suggestion: if it is found that the ridge is between 2 sizes, use the smaller of the 2 trays. The flexibility of the tray while in the rubbery state will spread outward to accommodate the ridge width. The tray will also spread to fit bony irregularities and small to moderate-sized tori. Using a smaller tray when appropriate reduces waste of impression material. Place the body of the tray in a controlled, heated water bath while leaving the handle slightly above the water level to allow for easy removal. The body of the tray should be completely immersed in the water at 165 degrees Fahrenheit, 74 degrees Celsius, for approximately 30 seconds, or until the tray becomes very rubbery. It is imperative that the water not exceed 165 degrees Fahrenheit, as burning or scalding of the patient or operator may result. Please note that when removing the tray from the water bath, it must be in the rubbery state and be very easy to bend. If not, then check to see that the water bath temperature and time suggestions were followed. Also, avoid shaking the water off, as this will accelerate the hardening process before you place it into the mouth. When the tray is easily manipulated and becomes rubbery, it is quickly inserted into the mouth. Inform the patient that the tray will be warm, but that the heat will dissipate in approximately 5 to 10 seconds. Use of retractors is recommended to facilitate rapid placement of the tray. The tray is placed, the retractors removed, and the tray is secured against the palate with the operator's index finger. The patient can shape the tray themselves by sucking their lips out firmly and then smiling vigorously. Through these facial movements, the tray will conform to the actual ridge configuration. Now remove the tray and analyze. The appropriate sized, properly molded tray should leave ample, even room for impression material, and the borders of the tray should not impinge on any soft tissue areas. Mandibular arch. Size the tray to match the closest ridge size. Again, if between sizes, use the smaller of the 2 trays. These trays are heated in a temperature-controlled water bath set to 165 degrees Fahrenheit, 74 degrees Celsius, with the handle slightly above the water level. The trays will require approximately 30 seconds to reach the proper working, rubbery state. The larger trays may take more time, and the smaller trays may take less time to soften. Care should be taken to not heat the trays above the recommended temperature to avoid operator and patient injury. When removing the tray from the water bath, make sure that it is not too difficult to bend. If so, then check the water temperature and time suggestions and make sure that they were followed. The water temperature must be at 165 degrees Fahrenheit, 74 degrees Celsius before the tray is placed into the water bath. Observe the rubberiness that can occur by following the proper heating instruction. When you have determined that the tray is easy to manipulate, go directly to the patient's mouth. Place the tray directly into the mouth using cheek retractors in order to assure access to the mouth quickly. The tray is secured with a finger on each side of the lower arch, and the retractors are removed. The patient is instructed to suck firmly, smile, and extend their tongue outward. This will customize the tray to the patient's ridge configuration. The tray is removed from the mouth and analyzed. The appropriate sized, properly molded tray should leave ample, even room for impression material, and the borders of the tray should not impinge on any soft tissue areas. The Massad Edentulous LT Low Temperature Impression Tray, the first step in a perfect edentulous impression.